Hi guys! Today, let's talk about serious signs and symptoms of vitamin D deficiency you should never ignore. Vitamin D deficiency increases the risk of not only cancer, but type 1 diabetes, cardiovascular disease, and osteoporosis. Exposure to sunlight, which enhances vitamin D production in the skin, is important because very few foods naturally contain vitamin D, and not many people supplement. And when they do, they supplement with the wrong type of vitamin D. One problem of the symptoms of vitamin D deficiency can seem fairly generic, so they are easy to overlook. Here are the signs and symptoms of vitamin D deficiency you should never ignore. 1. Tiredness or fatigue. Many of us feel tired or fatigued on an almost daily basis. In fact, this problem is so common that people often dismiss it as a simple fact of life. Feeling consistently fatigued can be an indication of a health problem, especially if you are already getting enough sleep. To make matters worse, fatigue is often poorly characterized in patients that experience it, and many people don't find solutions. This can have dramatic impacts on quality of life. The connection between vitamin D and fatigue may seem unusual, but there is evidence supporting it. For example, research has shown that those with higher levels of vitamin D in their blood were less likely to experience fatigue than those with lower levels of vitamin D. 2. Aches and pains. Another extremely generic set of symptoms of vitamin D deficiency is the presence of overall aches and pains, particularly in the muscles but also in the joints and bones. This pattern is another reason why vitamin D deficiency is often confused with fibromyalgia. Fibromyalgia is a condition that causes pain all over the body. 3. Depression. Vitamin D deficiency has always been linked to depression. This relationship has mostly been found in observational studies and appears to be especially common in older adults who are also a high risk for vitamin D deficiency. 4. Loss of bone density. A loss of bone density can exhibit in a number of ways, such as brittle fingernails, decreased grip strength, bone pain, and even muscles aches. Even though a loss of bone density is connected to vitamin D deficiency, taking high-dose supplements doesn't appear to help resolve this issue. Nevertheless, it's likely that having adequate vitamin D could help to prevent bone loss from occurring. This makes it important to keep your vitamin D and your calcium levels high to reduce the chance of bone loss, especially as you age. 5. Hair loss. In most cases, hair loss tends to get attributed to genetic factors or to stress. However, sometimes nutrient deficiency can also be a cause, including vitamin D deficiency. There is some evidence that low levels of vitamin D are associated with hair loss in women. Although there hasn't been much research on the topic, one particular disease that is connected to hair loss is alopecia, which is an autoimmune disease. Vitamin D deficiency may act as a risk factor for this disease, as many patients with it are deficient in vitamin D. So lower levels of vitamin D tend to be associated with a greater amount of hair loss. 6. Slow wound healing. One unexpected symptom of vitamin D deficiency is slower than normal wound healing. This action may be connected to the role that vitamin D has in controlling inflammation. Potentially, this pattern means that increasing vitamin D levels in vitamin D deficient patients can help to speed up the process of wound healing. However, one study did note that they found low levels of vitamin D in most patients with leg ulcers and that those with higher vitamin D levels experience better healing. 7. Compromised immune system. Your immune system plays a critical role in protecting you from disease and in fighting off harmful microbes. Our immune systems are complex and involved in many different components, but vitamin D does play a role in their effectiveness. As such, vitamin D deficiency can mean that your immune system does not function as well. When this happens, you may end up becoming sick more often, especially with colds and other easy-to-contact illnesses. Lack of vitamin D can result in mental disorders like schizophrenia and depression, infections like tuberculosis, upper respiratory tract infections, and asthma. Autoimmune diseases like type 1 diabetes, multiple sclerosis, Crohn's disease, and rheumatoid arthritis. Cancer of the breast, colon, prostate, and pancreas. How much vitamin D should we take? Official recommendations tend to suggest that people get between 400 to 800 IU of vitamin D each day, although other estimates suggest anywhere from 1,000 IU to 5,000 IU or higher to get the best health benefits. Regardless of the ideal amount of vitamin D that we need, it's clear that many people simply aren't getting enough of this critical hormone. One of the reasons for this is that people often assume that they have enough vitamin D. After all, vitamin D is produced in the presence of sun. So what are you waiting for? Let's go and let the sun shine on our bodies. happy friends! If you like this video, please subscribe to my very humble channel and press the bell icon so that you will notified about all my amazing and informative videos.